According to the President's Council on Fitness, Sports, and Nutrition, only 1 in 3 children are physically active every day. In fact, less than 5% of adults participate in 30 minutes of physical activity each day, and only 1 in 3 adults receive the recommended amount of physical activity each week. Today, I'm here to talk to you about leading a more physically active lifestyle and to tell you about the health benefits of leading a more physically active lifestyle, to convince you that there is enough time in the day to lead a more physically active lifestyle, and to allay any doubts of the risk of adverse effects of leading a more physically active lifestyle. First of all, the health benefits. According to the home of the Office of Disease Prevention and Health Promotion, there is up to a 40% reduced risk of premature death when leading a physically active lifestyle, which means that premature death means that anything other than dying of old age. Leading a more physically active lifestyle reduces the risk of diseases such as coronary heart disease, stroke, type 2 diabetes, and osteoporosis. It can also reduce the risk of some cancers, including colon cancer, lung cancer, and breast cancer in women. It can also reduce risk factors such as high blood pressure and high cholesterol. It can increase functional capacity in older adults, which is the ability to participate in activities that are needed for daily life. And it can also benefit mental health issues such as depression and cognitive function. Other benefits include increased bone density from resistance training and just an overall better sleep quality. The second thing I'd like to address is the amount of time it takes to lead a properly physically active lifestyle. A lot of people don't think that there's enough time in the day to be physically active. In fact, less than half of all adults don't meet the recommendations according to the CDC 2008 physical activity guidelines. And those guidelines are 2.5 hours or 150 minutes of moderate intensity physical activity, which is something such as walking or light jogging, maybe swimming, bicycling. And another reason that people tend to not participate in physical activities, they think that you need some sort of gym or special facility or equipment to participate, when in fact there are many activities you can do that you don't need any sort of equipment, such as walking, jogging, and bodyweight exercises, which are exercises that include push-ups, sit-ups, and pull-ups, all which you can do in the comfort of your own home. The final thing I'd like to address is the risk factors involved with participating in physical activity, which is, just includes the fear of getting injured from being physically active. And it all comes down to the type of physical activity that you are participating in, such as collision sports, which are higher risk activities when compared to things like brisk walking and swimming, which are very low risk. It's important to note that the rate of injury declines with increased fitness, and importantly, cardiac events such as heart attacks or sudden death are very rare, and they also decrease in risk when a person becomes more physically active, and are only especially risky when a person who is not active suddenly becomes physically active, doing something such as participating in a contact sport or a very vigorous physical activity. And overall, physically active people have a much lower risk, while active and otherwise, of having a heart attack or some other death-causing event. And finally, there's no good reason to not be physically active. There will always be time in the day to be physically active for at least 30 minutes a day, 5 days a week, which would allow you to meet your 150-minute guideline per week of physical activity. The bottom line is that the health benefits of being physically active are too great to ignore, and they far outweigh the risks involved.